how about the billing aspect and the CPT selection, utilization, optimization, perhaps? Can you talk a little bit more about that piece?
So there are obviously thousands of different interventions that you can do as a physical therapist. And there's the CPT coding that you can do TheraX, TheraAct, Neuro, et cetera. And that is kind of a tricky problem to like always know exactly, which activity you can count as which thing. And some folks are really good at it. Some folks are a little bit less good at it. But when you're kind of in this gray area of like, oh, what's my intent, right? Because it's already kind of a squishy thing. My intent is I'm treating the patient for exactly what component of their well-being. You're probably just thinking like, I want the patient to get better. You're not always thinking about like, oh, is this going to be functional with regards to like crossing multiple joint regions, et cetera? Or is this more coordination or whatever? You have a sense of it as an experienced physical therapist. But then that mapping problem to the interventions and what's justified is usually complicated just enough that people will kind of err on the side of, I'm just going to go with TheraX. And so what we've done is we've trained a model by going through a huge number of examples and data sets so that it will, most accurately identify like this activity or this justification statement, which again, you can write in so many different ways, would most likely reasonably map to this CPT code. And then we provide people that feedback. And, if they're picking a code that's, maybe a little bit too high relative to what they're doing, they can either justify it so that it matches, or they can adjust the code. And you can go in either direction because we want to be accurate. That's the really important thing here. The model is designed to take what you are saying or justifying and to pick the code that it most accurately represents